Welcome to our guide on how to enroll in Medicare for individuals 65 years or older. In this video, we'll walk you through the essential steps to ensure you have the coverage you need. Medicare consists of four main parts. Part A covers hospital insurance, Part B covers medical insurance, Part C is Medicare Advantage, and Part D covers prescription drugs. The initial enrollment period is a 7-month window around your 65th birthday. Enrolling during this period ensures you have timely coverage and avoid penalties. If you miss the initial enrollment period, you may qualify for a special enrollment period under specific circumstances, such as losing employer coverage. This period typically lasts for 8 months. The general enrollment period runs from January 1st to March 31st each year. It's for those who missed the initial enrollment period and don't qualify for a special enrollment period, but it may result in higher premiums. If you're receiving Social Security benefits, you'll be automatically enrolled in Medicare Part A. Otherwise, you'll need to enroll manually through the Social Security Administration. For Part B, consider your employment status and be aware of potential penalties for late enrollment. For Medicare Advantage, Part C, ensure you meet the eligibility requirements and enroll during the appropriate periods. For Part D, use Medicare's Plan Finder tool to choose the best plan and avoid penalties for late enrollment. If you're still working, have COBRA coverage, or are a veteran with VA benefits, there are special considerations for your Medicare enrollment. Make sure to understand how these factors affect your enrollment process. After enrolling in Medicare, you'll receive your Medicare card. Next, consider additional coverage options. Understand your benefits and avoid common mistakes to ensure you have the coverage you need. We've covered the essential steps for enrolling in Medicare. For personalized assistance, contact Craig Smith Insurance Group for a free consultation. Don't wait. Ensure you have the coverage you need.